Abdomen, pelvis, perineum. Anterior abdominal wall. Scarpa's fascia is attached to fascia lata of thigh. In patients with penile injury, Colles fascia prevents extravasation of urine in ischiorectal fossa. The nerve supply to the skin around umbilicus is 10th thoracic ventral ramus. Highest level of iliac crest is at level of L4. In rectus sheath, inferior epigastric artery, branch of external iliac artery, makes anastomosis with superior epigastric artery. Conjoint tendon is formed by internal oblique, transverse abdominis. Pyramidalis is supplied by subcostal nerve. Rectus abdominis is inserted into the xiphoid process. The afferent limb of cremastic reflex is provided the genital branch of genitofemoral nerve. Afferent of cremastic reflex is genitofemoral nerve. Cremastic muscle is supplied by genital branch of genitofemoral nerve. Inguinal canal. Length of inguinal canal is 4 cm. Inguinal canal is intermuscular canal. Deep inguinal ring is deficiency in transversalis fascia. A common structure in Hasselbalch triangle and femoral triangle is the inguinal ligament. Inferior epigastric artery forms lateral boundary of Hasselbalch triangle. Posterior abdominal wall. Ovarian artery is a branch of abdominal aorta. Superior pancreaticoduodenal artery is a branch of gastroduodenal artery. The gastroduodenal artery is derived from hepatic artery. Right suprarenal vein drains into inferior vena cava. Hepatic vein drains directly into inferior vena cava. Obstruction of inferior vena cava presents in thoracoepigastric dilation. Left testicular vein drains into left renal vein. Miscellaneous. The cisterna chyli are situated in the abdomen. Lymphatic drainage of cervix is to iliac lymph nodes. Anterior or anterolateral to aorta positions best describes the location of celiac plexus. Greater splanchnic nerve supplies the celiac plexus. Male reproductive organs. Lymph from glans penis drains into deep inguinal lymph nodes. Correct order of pathway for sperm is straight tubules, rete testis, efferent tubules. Lymphatic drainage of testis is the para-aortic lymph nodes. The artery to the ductus deferens is a branch of superior vesical artery. The artery of ductus deferens arises from inferior vesical artery. Helsine arteries are branches of deep artery of penis. In fracture of penis involving rupture of tunica albuginea with intact buccal hematoma involving only shaft of penis can be seen. After herniotomy, loss of sensation of scrotum, root of penis is due to injury to ilioinguinal nerve. Internal spermatic fascia is derived from fascia transversalis. The intricately and prodigiously looped system of veins and arteries that lie on surface of epididymis is known as pampniform plexus. Location of testis is higher on right side. Carporoamylacia is seen in prostate. Ovary and fallopian tube. Pain of ovarian pathology is referred to median thigh. Para-aortic lymph nodes drain the ovary. Ovarian artery is a branch of abdominal aorta. Lining epithelium of fallopian tube is ciliated columnar. Parts of fallopian tube from lateral to medial is infundibulum, ampulla, isthmus, interstitial. Part of fallopian tube that act as functional or anatomical sphincter is intramural part. Sensitive supply of fallopian tube and ovary is from spinal nerves T10 to T12. Normal anti-flexion of uterus is 125 degrees. Weakest support of uterus is broad ligament. Lining epithelium of uterine cavity is ciliated columnar epithelium. Lymphatic drainage of cervix is to iliac lymph nodes. Gardner duct is present in broad ligament of uterus. Length of female adult cervical canal is 2.5 cm. Ratio of connective tissue smooth muscle in cervix is 8:1. Ratio of connective tissue to smooth muscle in cervix is 8:1. Length of posterior vaginal wall is more than anterior vaginal wall. Blood supply of upper part of vagina, cervicovaginal branch of uterine artery. Bartholin gland are related to the lateral wall of vagina. Mucus glands are absent in vagina. Lining epithelium of vagina is non-keratinized stratified squamous epithelium. Pelvis and perineum. Deep perineal pouch contains the membranous urethra. Superficial perineal muscles include bulbospongiosus. Superficial muscles of perineum is the ischiocavernosus. Ischiorectal fossa communicates with other side posteriorly. Injury to the male urethra below the perineal membrane causes urine to accumulate in superficial perineal branch pouch. Pudendal canal is a part of obturator fascia. Nerve supply to perineum is pudendal nerve. Pelvis. Branch of internal iliac artery is superior vesical artery. Branch of posterior division of internal iliac artery is superior gluteal artery. In case of aberrant obturator artery, it arises most commonly from inferior epigastric artery. Pain is mediated by autonomic nerves. Pelvic splanchnic nerve is formed by anterior rami of S2, S3, S4. The inferior hypogastric plexus is located on side of rectum. Superior hypogastric plexus is located at anterior aspect of aortic bifurcation and fifth lumbar vertebra. Hypogastric sheath is condensation of pelvic fascia. Sacral promontory is the landmark for termination of presacral nerves. Urinary bladder and urethra. The cave of Regius is present in front of bladder. Bladder develops from endoderm. In bladder injury, pain is referred to upper part of thigh, lower abdominal wall and penis. Urinary bladder and urethra. Bulbourethral glands open into spongy part of urethra. Cowper glands are found in membranous part of urethra. Shortest part of male urethra is membranous. Sphincter urethra is present in membranous urethra. Ejaculatory duct opens into prostatic urethra. Urethral crust is situated in prostatic urethra. Lymphatics from spongy urethra drain into deep inguinal nodes. Length of female urethra is 4 cm. Length of male adult urethra is 20 cm. Support of prostate is pubococcygeus. Kidney and ureter. Left renal vein crosses aorta anteriorly below superior mesenteric artery. Renal papilla opens into minor calyx. Nerve supply of kidney is from celiac plexus. Correct relationship of structures at hilum of kidney from anterior to posterior is the renal vein, renal artery, renal pelvis. Structure that does not cross the midline is the left gonadal vein. Renal angle lies between 12th rib and lateral border of sacrospinalis. Left renal vein is posterior and inferior to superior mesenteric artery. Transitional epithelium is present in renal pelvis. Most medially located renal structure is renal pelvis. Ureters. Narrowest part of ureter is at ureterovesical junction. Ureters are identified during surgery by peristalsis due to flow of urine. Suprarenal gland. Para-aortic lymph nodes drain the suprarenal gland. Right adrenal vein drains into inferior vena cava. Peritoneum and peritoneal cavity. Root of mesentery is crossed by horizontal part of duodenum. A posteriorly perforating ulcer in pyloric antrum of stomach is likely to produce initial localized peritonitis or abscess formation in omental bursa. Epiploic foramen has bile duct anteriorly. Omental bursa is located in subhepatic quadrant. Pouch of Douglas is situated between uterus and rectum. Subdiaphragmatic right posterior interperitoneal space is Morrison's pouch. Inferior mesenteric vein is found in relation to paraduodenal fossa. Intersigmoid recess is constantly present in infants. Left ureter lies in intersigmoid recess. Fascia of Denon Wellers is the fascia between rectal ampulla and prostate and seminal vesicles. Blood vessels of the gut. Superior pancreaticoduodenal artery is a branch of gastroduodenal artery. The gastroduodenal artery is derived from hepatic artery. Right gastroepiploic artery is a branch of gastroduodenal artery. Left gastric artery is a direct branch of celiac trunk. Cystic artery is usually a branch of right hepatic artery. Left colic artery is a branch of inferior mesenteric artery. Appendicular artery is a branch of ileocolic artery. Inferior mesenteric artery takes part in formation of marginal artery. Arterial supply of duodenum is by both superior mesenteric and celiac arteries. Splenic artery gives short gastric arteries along the fundus. Short gastric artery is a branch of splenic artery. Posterior gastric artery is a branch of splenic artery. Inferior mesenteric vein drains into splenic vein. Portal vein supplies liver. Portal vein is formed by union of splenic and superior mesenteric vein. Portal vein is formed behind the neck of pancreas. Whole portal venous system is valveless. Stomach. Nerve of Gracie is a branch of right vagus nerve. Nerve of lateral jet of vagus is seen in stomach. Most important blood supply to stomach is left gastric artery. Small intestine. Brunner glands are seen in duodenum. Superior mesenteric vein is related to third part of duodenum. Minor duodenal papilla is the opening of accessory pancreatic duct. In the ileum, the lymphatic patch is along anti-mesenteric border. Valvulae conjuventis is seen in jejunum. Valvulae conjuventis is also known as walls of Kerckring or walls of Kerckring or plicae circularis or plicae circulae. On contrast radiography, the proximal part of duodenum has a cap, large intestine. The shortest part of colon is ascending colon. Terminal group of lymph nodes for colon is pre-aortic. Appendix epiploicae is present in sigmoid colon. The commonest anatomical position of appendix is retrocecal. Length of anal canal is 35 to 40 mm. Upper half anal canal is insensitive to pain. Valves of Houston disappear after mobilization of rectum. Puborectalis is essential to maintain continence of anal canal. Referred pain in external hemorrhoids is due to inferior rectal vein, branch of pudendal nerve. Waldeyr's fascia lies behind rectum. External anal sphincter is innervated by S2, S3, S4. Hepatobiliary system. Weight of liver is between 1400 to 1600 grams. Space of disease is seen in the liver. Cournot's segmental nomenclature is based on position of hepatic vein and portal vein. Right lobe of liver consists of 5, 6, 7 and 8. Relation of caudate lobe of liver is anterior to right inferior phrenic artery. Venous blood of liver is drained by hepatic veins. Ligamentum teres of liver is a remnant of left umbilical vein. Blood supply of liver is 20% from hepatic artery and 80% from portal vein. Extrahepatic biliary system. Lymph node lies between cystic duct and common hepatic duct. Spiral valve is seen in cystic duct. Valve of Heister is seen in cystic duct. Fibromuscular valve is seen in gallbladder. Sphincter of Oddi consists of 3 sphincters. Pancreatic and bile duct open into duodenum at ampulla of Vater. Spleen and pancreas. Spleen extends from 9th to 11th ribs. Downward displacement of enlarged spleen is prevented by phrenicocholic ligament. Anterior end of spleen is held up by phrenicocholic ligament. Spleen projects into greater sac. Stave cells are seen in spleen. Pancreas. Structure immediately posterior to pancreatic head is the right renal vein. Neck of pancreas is related on its posterior surface to superior mesenteric vein. Tail of pancreas related to splenorenal ligament. Most common congenital anomaly of pancreas is pancreas divisum. Pancreas divisum indicates failure of fusion of dorsal and ventral pancreatic duct,